Men, let's understand how to live long. You see, men generally have shorter life expectancy than women due to a combination of biological, behavioral, and social factors. Interestingly, while women live longer on average, they tend to experience more chronic illness or disability in later life than men. Men's shorter lifespan might partly result from dying faster but healthier due to acute conditions like heart attack, whereas as women often live longer with degenerative diseases. I know you'll be wondering, Fred, how did you find out about all this? Well, if you are going to be making money, you want to also be conscious of your environment, the things you do, and also you need to also understand that if you don't have a good health, you don't live a good quality life, then the purpose for which you are finding the money will be defeated. And more so, you will die before your time. For men, heart attacks often stems from immense stress they bear as husbands, fathers, and in many cases, the primary breadwinners for their families. You see, added to this is the relentless pressure of striving to succeed in their careers. As many are aware, men are often conditioned to suppress their struggles, choosing to endure silently while seeking solutions on their own. Yet, this quiet endurance often comes at a cost, as they carry the weight of numerous responsibilities and challenges. Hold it down. You see, when you talk about these challenges, side chick has complaint, wife get complaint, family get complaint, extended family get complaint. Those ones when they carry religious church matter for head, church people, church matter get complaint. If you have a small startup staff, so many stuff they get complaints, and if you add their own personal bills, sometimes they don't even have what it takes to bear those complaints and challenges. But they won't say it, they won't complain, because we are not wired to complain. And when viewed through the lens of biological, behavioral, and social factors, these burdens significantly impact our health, potentially our longevity. So let's look at them individually. Let's look at biological factors. Hormonal differences, for example. Our testosterone, the primary male hormones, is linked to the riskier behavior and increased aggression, which may contribute to higher accident rates. It also impacts our cholesterol levels, potentially increasing cardiovascular risk. How about our weaker immune systems as men? On average, men have less robust immune response compared to women, partly because of genetic differences. Example, the protective effects of a strong X chromosomes in women. How about the higher prevalence of certain disease? Like men are often likely to develop conditions like heart disease, liver disease, and some cancers. Example, prostate cancer, cardiovascular diseases, in particular are leading causes of death in men. You see, like prostate cancer, for example, it is made to understand, or research shows that black men are faced with the possibility of having prostate cancers. I remember when I turned 40, when I went to see my primary care doctor, he subjected me to one assessment. If not that he was a medical doctor, I would have really, reacted. But only for him to expect that he was checking for my prostate, condition. Gratefully, I'm not, How about behavioral factors? Risk-taking tendencies. Men are more likely to engage in high-risk activities such as reckless driving, substance abuse, and dangerous sports. Increasingly, the likelihood of accidents and injuries are very high. How about the healthcare avoidance? Men are less likely than women to seek medical care or preventive screenings. Delayed treatments can lead to worse outcome for otherwise manageable conditions. Smoking and alcohol use. Historically, men have higher rates of smoking and excessive alcohol consumption, both of which are linked to chronic diseases and premature death. Yes. How about social and cultural factors? Stress and work strain. Men often work in high stress or physical demanding jobs, which may lead to chronic health conditions or problems or workplace accidents. You see, men take very high risk. There are jobs that men would take. Our opposite sex women would not try it. They won't try it. Very risky jobs just to put food on the table. Yes. How about cultural pressure? Societal expectations around masculinity can discourage men from expressing vulnerability, which I've spoken about that already. Seeking help or adopting healthier lifestyles. How about loneliness and mental health? Men may experience higher rates of social isolations and are less likely to seek support for mental health challenges, contributing to higher, suicide rates in men. Interestingly, while women live longer on average, it tends to experience more chronic illnesses or disability in later life. So men's shorter lifespan might partly result from dying faster but healthier due to acute conditions. So in all this, seek to make good money as a man so you can at least live a quality life within those years of your lifetime. This is why I encourage young men like me. Tech is the oil of the moment. Come into the tech space. Make some good high earning six figure. Live a quality life. Invest in business. I mean, all of us cannot be born with a silver spoon. You can create your silver spoon. Alright? Men, those of you that are still struggling to transition into the tech space, please make 2025 a time where you make that stride. Without your degree, and even if you don't have one, you can start from somewhere. When you have quality money in your hands, most of what I just mentioned, you would surpass them. See you all at the top. The bottom is crowded.